Today I've got Nicky McLeod. Nicky is a breathing coach and Butekyo expert. Now, Asthma New Zealand have a long relationship with Butekyo, which is a breathing methodology that works really well with a lot of our patients. Nicky, welcome today. Really great to have you here.
Hi, Catherine. Thank you.
Nicky, tell me, I'm fascinated. What got you into becoming a breathing educator?
Well, for 13 years, I was medicated for epilepsy. I had grand mal and partial complex seizures that came on after the birth of my first child. And I enrolled in a breathing retraining course with Glenn White in Auckland, not actually for the epilepsy. I had absolutely no idea that there was anything wrong with my breathing. I was doing it for my husband's snoring. I actually mouth breathed all night and half of the day and breathed fast and deep, mainly using my upper chest muscles, and sighed heavily all day long. And these are all signs of dysfunctional breathing, but I had no idea. And then the improvements in my health and my well-being after doing a course with Glenn were significant. And I learned about functional breathing and started to incorporate this new knowledge. And within 6 months, I was able to come off all my epilepsy medication, and I've never had another of either type of seizure. So it was pretty life-changing, and I went on to train as a practitioner and set up the breathing clinic in Nelson in the South Island.
Wow. It's fascinating in terms of the impact for you personally, and I think that that is certainly what drives a lot of practitioners into this conversation. You talked about breathing in terms of being a mouth breather, and you mentioned something about chest breathing. Well, can you explain what you mean by chest breathing?
Well, a normal, healthy, resting baseline breathing pattern is nasal, silent, 8 to 12 breaths per minute, smooth, even, and regular, and it's 80% diaphragmatic. I'm not sure if you can see that there. Most of the movements down here in the diaphragm, but it's really common today for people to be switched up to the upper chest muscles and to be breathing predominantly from here. So they're also known as the secondary respiratory muscles, even up into the neck. And it's a really tiring way to breathe using mainly these muscles. We actually call them oxygen robbers. They're small muscles and they're not designed to carry the load of breathing. And in comparison, the diaphragm is a really powerful muscle like the heart. It's designed to go from our first breath to our last. And the upper chest muscles, on the other hand, as I just said, they're not designed for constant use. And it's a very inefficient way to breathe, to be mainly using these muscles. So breathing from the upper chest muscles uses 25% oxygen, whereas breathing from the diaphragm uses just 2% oxygen. So a big difference in the energy required just to breathe.
Wow.
If you're using the wrong muscles. Yeah. So, and if you think
that would change the way in which an individual get the benefit out of breathing.
Yes. Yeah. So the message is, you just don't need to use all of these muscles when you're just going about your everyday life. And if you think of breathing as information for the body, when you breathe using your emergency backup muscles, which are these upper chest muscles, you're constantly giving your body the message that you're in danger. It has you in a sympathetic.
Yes. So why do we chest breathe? Why do we tend to chest breathe?
There can be a number of reasons. If you breathe through your mouth, you will straight away engage your upper chest muscles. And as I said, activate the sympathetic nervous system. Being stressed, holding tension in your belly will inhibit the diaphragm so that the upper chest muscles step in to assist the diaphragm. Having a poor posture is a really big one. So if you slouch, or probably the opposite of that is that you kind of jam yourself right upright and your ribs jut forward, that will inhibit the diaphragm, and then the upper chest muscles have to step in to help. So it can be a number of factors, and it's all pretty basic stuff, really. Mouth breathing, poor
I know
posture.
I hear this all the time. People talk about basic stuff, but I've certainly, since I've been in this conversation, become incredibly aware of how I breathe. However, I watch people every day now. I'm not sort of stalking them. However, I'm watching now how people breathe, and New Zealanders breathe all through the chest.
Yeah,
How does that chest breathing affect our community, our community with respiratory conditions such as asthma?
Upper chest breathing, it can exacerbate asthma in that it contributes to over-breathing, which just means breathing in excess of metabolic requirements for whatever it is.
So you can over-breathe?
Yes, over-breathe. I mean, as soon as you open your mouth, you're going to double the amount of air that you're breathing. You're going to engage your secondary respiratory muscles and breathe more than is normal. And over-breathing is as devastating for our health as overeating, and not so well known or understood, actually.
No.
So, over-breathing, it's hyperventilation. It leads to a reduction of carbon dioxide in your lungs and your blood. And you've actually got over 100,000 kilometres of tubes in the body. That includes your airways and your blood vessels. And all of these tubes have smooth muscle wrapped around them. And carbon dioxide is a smooth muscle relaxant. It keeps your airways and your blood vessels open. And when carbon dioxide levels in the lungs and the blood are less than ideal, and generally that would come about from over-breathing, this can lead to smooth muscle spasm around the airways. So you can imagine the link to asthma. This makes it more difficult to breathe and leads to over-engagement of the upper chest muscles and contributes to over-breathing. So as you can see, we're talking about a really vicious cycle at play here.
Absolutely. So, Nicky, how would I know what type of breather I am?
Yeah, that's a really good question. So there are a few tips I can give you to work it out. So if you were to put one hand on your chest and the other hand on your belly, just under your ribs, that's where your diaphragm is. And then, so tune into your breathing for a few breaths. Just really notice how you're breathing. And start to notice which hand moves most when you breathe. And if it's the upper chest, then it's likely that you are breathing predominantly from your upper chest muscles, from your secondary respiratory muscles.
Yeah.
And then also, so what we're checking there is just, how you're breathing at rest. But it'll be interesting too for you to test how are you breathing when you're out exercising. So next time you're out walking, do the same thing. Notice whether you tend to be upper chest breathing when exercising. And also notice what happens when you're stressed. You'll really notice a shift there.
Well, I think that's so, because one of the things that's interesting is, I'm getting conflicting messages because what we're told is when we're stressed to take big, deep breaths. Is that correct?
It is. It is. No, that's a very common message. The belief that deep breathing is good for us is just rife in Western society, really. But no, big, deep, full diaphragm breathing is not what we're talking about here. It's really the opposite of a good breathing pattern. So people often associate diaphragm breathing with big, deep breathing and emptying and filling their lungs. And this actually leads to over-breathing and all the problems caused by reduced carbon dioxide in the lungs and the blood. So a normal breath at rest is just 500 mils. Actually, I'm going to show you what that looks like. If you think of, one water bottle, 500 mils, and this is just 1/8 of your lung capacity. So,
right.
That gives you an idea, in and out, one breath, it gives you an idea of just how small a normal breath is. So diaphragm breathing, when it's done correctly, is small volume breathing. And often when we teach diaphragm breathing, breathing educators, there's a lot of unlearning to do where we need to dismantle the associations that people have between diaphragm breathing and concepts such as big, deep, full, abdominal or belly breathing, because all of these concepts lead to large volume diaphragm breathing.
Well, Nicky, it sounds to me like we definitely need to have another conversation, because it sounds like there is a lot. I'm like, okay, so if I find myself out exercising and I find myself chest breathing, what do I do? I've got all of these questions that are bouncing up in my brain right now. From a selfish perspective, I don't want to be over breathing, so. As we leave today, what's the one thing that I should start to be thinking about in terms of breathing more efficiently and effectively?
It starts with the basics, really, which it all starts with posture. Having a relaxed, upright posture, and also you could add breathing through the nose, because the nose and the diaphragm go together, and this promotes the relaxation response. Whereas breathing through the mouth engages the upper chest muscles and the fight or flight response. And then the next thing to do is to learn what it feels like when you diaphragm breathe.
So, Nicky, before we finish up today, if I discover that I am chest breathing, what's the single most important advice that you would give me to start to transition to more diaphragmatic breathing?
It starts with the basics, and I would advise you to have a look at your posture. The basics mean having a relaxed, upright posture, head over your spine rather than a forward head posture, and always breathing through the nose. Those things together are a really good start. The nose and the diaphragm go together, and this promotes the relaxation response, whereas breathing through the mouth and slumping and having a poor posture tend to engage the upper chest muscles and the fight or flight response. So you can't underestimate the basics.
And I think that's the same. That's the same in life, isn't it, really, Nicky? This has been so insightful. Thank you so much. I'm really looking forward to picking up the conversation, because I think that we really owe it to ourselves to deep dive on some of these points that you've made today. And so in the coming months, we want to be doing some more of this with you, so that our viewers can get some really insightful tips from you. Thank you so much. Looking forward to reconnecting with you in the coming weeks.
You're very welcome, Catherine. I look forward to continuing the conversation too. Thank you.
Thanks, Nicky.